By the time the patients get to us, they're really at that point in life where their function has dropped significantly because of their hip or knee pain. My hopes for every patient are to get them back to a point where they felt like they were living a more fulfilling life. My name is Anthony Wiggins, and I am an assistant professor in the Department of Orthopedic Surgery here at UCSF in the Division of Arthritis and Joint Replacement. In my practice, what I'm focusing on is helping patients with debilitating degenerative changes in their hips and knees. We address those issues with total hip and knee replacements as well as revision arthroplasties. My practice is up in Marin. I'm at the 4000 Civic Center Drive facility up on the hill. It's a multi-specialty orthopedic practice. Typical age range is going to be 50s to 90s, but really any patient with a debilitating hip or knee condition with no real options for other non-operative or conservative treatments. As a surgeon, I try to pose myself as a partner for my patients, right? Someone that they can be honest with and that will be honest with them about their pathology and the options that we have. I went to Harvard for undergrad, went to University of Virginia for medical school, spent some time down there, and then matched at UCSF, of course, for residency, where I trained from 2019 to 2024, prior to matriculating to the Hospital for Special Surgery for my hip and knee replacement fellowship. And fellows will finish the year with somewhere between 600 and 700 cases under their belt. Up at UCSF Marin, another thing that I'm working on right now, and I'm in the process of, is building a robust robotic arthroplasty program, both on the hip side and the knee side, so that patients have the option of having their hip or knee replacement done with the assistance of a robot or some sort of computer navigation system. I think it will also be a very important educational tool for our residents and fellows to come up and learn how to perform these surgeries with the most advanced technology that we have available. So my ideal post-op patient is someone that comes in at 6 or 12 weeks post-operatively and tells me, Doc, I wish I would have done this sooner, because I'm back to doing the things that I love and enjoy, and I'm feeling more like myself again.